coming to the symptoms of how you can diagnose, because as I've seen, there are so many MBBS people with us, so many nurses with us. See, obviously the symptoms go unseen, they are not so evident, but looking at some of these factors, you might understand that she is in a need for she's in a need for having some person to even talk to. Probably she needs counseling, she has some issues, it's necessary to engage. Now every individual is different, every mother will be different. During her pregnancy she might have different around surroundings and different kind of stresses, because of which their symptoms and their intensities might vary. Now if you see towards this entire cycle, we talk about the insomnia, sleep disturbance, anxiety, fatigue, lethargy, mood swings, guilt, restlessness, dizziness, hypervigilance, panic attacks, self-harm. These are some of the common things which you'll see when the woman is during the pregnancy. But once that the child is born, there are other things that we need to be careful. She might face difficulty in interacting with the child, or even that initial stage of breastfeeding she may not be able to provide engage with the child so much that lactation might be affected. Proper nurturing care, proper change from basic things like changing the diapers, or maintaining the hygiene, cleaning, that basic massage to the child, kangaroo mother care, even those things might be missing. Then the other thing what we might see is she might have delusions or hallucinations, which are again quite rare. It's only seen in some cases of postpartum psychosis. And other common thing which might be seen is the thought of harming the baby. Now these are some of the very common symptoms. Those which you see inside those, that cycle kind of thing, are the more common ones. What we see outside those 4 blocks are the ones which are a little more severe, and it can be intensified mostly during the post-delivery phase. So as a doctor, as a nurse, what are we supposed to do? We are supposed to be identifying these symptoms. It's okay, we might be wrong, there is no harm in identifying and then talking about it, because this is where we need to be on our proactive side, engage with those people and understand that if she is facing through something, if we are able to nip that issues right in the early stage, the mother and the child will have a proper development and growth cycle. So it's very important to have a you have to be cognizant of these factors, you have to be cognizant of these symptoms, and then be ready to identify and then discuss about it. Then what we are going to talk lastly is what can be done. So I think before I take a break over here, I would like to pinpoint on just 2 or 3 important points. The first thing which I've been continuously saying is it's always important that we look at the mental health on a preventive side rather than going for a therapeutic aspect. It's not necessary that you have to give medicines to treat a condition. The second thing is, when we talk about mental health, it's important to let that patient or that person feel involved, feel attended. The minute you start giving attention to that person, you are a step ahead in handling that person. The third thing is, as professionals, it's our duty to identify such patients. We might be wrong, we might go have some other thoughts and ask them such questions. They may not like it, but it's okay. We need to find it out, we need to interact with them and understand what is necessary, what's happening, and then if required, take actions. So what I have done over here is I have broken down how we are going to encourage or how we are going to engage and deal with such cases in 2 parts. The first slide which you're seeing here is what can be done before or during pregnancy, and the next slide is talking about post pregnancy. So as I said, sometimes pregnancy is very sudden, sometimes it's planned. And in both the cases, we need to understand that, whether that lady, that female, whether she's willing to be a mother or not. But before we jump into any of those questions, we need to be patient. There's this gather approach which is very common in counseling. So we talk about, greet them, ask them their question, tell them what you understand, then hear them out again, engage, and review those patients follow up. So that's the broad gather approach. So here what I am trying to tell you is, you need to be patient, you need to talk about, hear them out, and first listen to them, talk to them, and then see what she is going through, and then take actions accordingly. So suppose if you identify such a patient, understand whether she is having that willingness to be a mother, understand what background she comes from, what are those factors which are associated with her, which you think might be giving her some sort of stress or anxiety, any kind of misleading thoughts, those things you need to understand that. Then provide her a platform to engage with her partner. So sometimes what happens is, women, especially in India, they are not that open enough to talk about such things with their partners. So as healthcare professionals, we should seek them, provide with them that platform to engage with their partner and have a very meaningful conversation, that what is she dealing with. And as we should be a third person just trying to have that conversation go in a fluidity, not be a biased individual putting our thoughts there, rather just being there as a third neutral party, providing them that opportunity to engage. So once we understand her cultural, her individual factors which are leading to stress, once we have that opportunity, we provide her that chance to engage with her partner and discuss things out, we have tried to solve a bit of their concern, say 30% of it, because now at least her partner and she are on the same page to understand whether they are willing to have that child or not have that child, and if they're planning to have that child, how would they want to take it forward. Then, as next step, we should encourage both the parents to be a part of the antenatal counseling. It's not just the mother's responsibility to be pregnant and handle the well-being of the child, deliver, and then take care of the baby. It's also the father. So, as healthcare professionals, we should be it doctors or nurses or whosoever, we should encourage both the mother and father to be a part of the counseling sessions, so that they can understand more on the development of the child, how the different organs are building up, and let them have that opportunity to share their joy, build a stronger bond between the mother and father, and between the parents and the unborn child. Then if still you see that these such pregnant women are not able to come, or there are some concerns because of which she is not able to visit, we should ensure that we can provide some scheduled home visits. That will also help us to understand the surroundings, the again socioeconomic status, and if in case she has some other home stressors which she is dealing with, probably that would be a good idea to even understand. So when we are when we are trying to engage with such patients, we should always be very cognizant of the surroundings as well. A lot of things these patients may not tell us, and that is where it's necessary that we have a look at their uh, non-verbal cues as well, understand those things, and then engage with them. The other thing what is necessary to be done is, once all of this has happened, still if things are not improving, have some validated tests to make sure that if she's feeling depressed, it is validated through some standardized tests. Like I told earlier, there are some WHO self-responding forms, there are other the CDC format, then there are a lot of other postnatal depression format which is developed by John Hopkins University. So there are a lot of them. Try and understand and take a validated test to measure, quantify what that female or what that mother is going through, and then if required is where we'll have to go and suggest any medications. In the meantime, what other thing can be done is to help her go through whatever she's feeling with, you can ask her to register for support groups. So now what has happened, COVID in this case has given us a lot of opportunity to engage online. You do not have to sit in a group. You can always, find groups on Facebook or some other social media, have like people who are just mothers across India or across your city or something. Just talk, a lot of times letting them have that engagement with other people will also help them relieve their stress. So these are something which can be done on the non-therapeutic side. As I said, if in case you're able to clinically validate that the female is going through some sort of depression, and if she requires any medications or something, then go for a low cost psychotropic therapy or psychotropic medication if necessary, but that's only very, very rare occasions that you need to do it. Otherwise, it's not something which is very preferred. As you all know, during pregnancy, a lot of medications are anyhow contraindicated. So this is not something which should be the preferred option. And then, if at your level you feel that it's it's uh, it's not handled well, or if you need other support, and if you see that the patient requires more support, then you can refer her to other facilities or higher facilities. And then lastly, this is my last slide and I'll finish my talking. So what I was saying was that, that was something that you need to do during her phase of pregnancy or before pregnancy. What will happen is, sorry, once you have taken those actions, you are providing that female a very secure environment where she may not be judged, but she will not be judged. But she can talk to a health professional like you. She can be a part of a support group where she can share her worries, her concerns, discuss those things. She can come to you if she needs some medical treatment. She is also having that opportunity to be on the same page with her husband, with her family, and discuss the next steps which needs to be taken. And if they move towards having a child, they have that opportunity to build it together, engaging during that pre-pregnancy phase, interacting more, understanding her worries. So she is on all the surroundings, on all the sides. You are giving her that security, that atmosphere, that anyhow, as a counselor, as a helper, you are there. But apart from you, she also has a family. She also has different groups where she can go, she can interact. She's not alone in all this. And once that the child is delivered, you can always suggest for the, go ahead and ask her to continue being in that support group where she has probably found people to interact. She will learn on how the other people are dealing with it. And then you can provide her other psychological therapies based on how her surroundings are. Because again, in India, we have different settings have different types of cultural activities or rituals which happen once the child is born. So we cannot outrightly go and say, don't do this, don't do that. Rather, once you are engaging with such patients and you understand what their cultural background is and what rituals might be there, you can then in that phase provide her guidance to deal with such situations which are culturally sensitive but still are therapeutic in nature, to help her go through that phase. Once that early phase is done with, to engage the mother and child more, you should make sure that the mother is more sensitive towards needs of the development. Ask her to have more interactions, and try developing more stimulus. Initially, it might just be that uh, you know uh, active listening or active identification of symptoms or something due to the worry about her child. But then through proper counseling, through proper engagement, mold her thoughts so that she's not looking at it as a concern or as a worry. Rather, she can use those feelings in a molded way to see it as a maternal responsiveness, her response to protecting her child, to building that bond. That is how she is going to get rid, or get out of those negative emotions and deal with the child and bond further. The other thing what needs to be done post pregnancy is providing those psychoeducational interventions, which can come in the form of the support groups, or it can also be through some form of trainings, or even some online lectures which can help her, calm herself down, that that influx of negative thoughts are limited. And as I said earlier, she has her own support groups. But once that the child is born and she is in a community, ask her to be a part of those community-based interventions, engage with the society, so that she has that way of living her life as well. She's leading her life. She's being a mother, and she's doing things that she likes. It can be again a vocational training. It can be some um, cultural activities going on in her community, or helping the people, something like that, whatever she wants to do, but let her be a part of the community. Once that the child is delivered, it's grown above say 1 year or something, she still needs to be be that person who is engaging with the community, and if required, she can go and talk to those support groups if needed. Lastly, where I would like to end is that currently there's a lot that is going on. We are talking about the different phases where mental health needs to be taken care of, but the most important thing is that a greater awareness is needed. There is still a lot of stigma in people. They do not talk about mental health. They do not want to talk about what are they dealing with during their pregnancy, during even during the normal stages of life. It's important that that awareness is created. Now amongst you people, there might be many of them who would have some phases of irritation or anxiety during the pre-COVID phase. You're not able to meet your friends, not go for your clinics or whatever. So every person has a different way of dealing with it. Right now still we are able to understand because we belong to that field. But what needs to be done is, during your field visits, during your engagement with such patients, you need to create that awareness. Tell them that it's okay to be perplexed. There's nothing wrong in that, and it's okay to have someone help you get out of it. If you're feeling something negative, it's okay to come and engage. So that kind of awareness is required. It's very important that people have that public knowledge and that recognition that it's there is mental health problem, and people through different phases of life go through it, but there are ways of addressing it itself. So as healthcare workers, we have our own skills where we can deal with them, engage with them, and tell them how to overcome that. So we should all work together, identify these people in the beginning itself, and if they come towards the later phase, we should look through proper measures. And how we should walk through it is, make sure that you first go through the preventive side, and if you see that the preventive aspect is not working, then find help or do something to look at it from the therapeutic aspect. But this is very necessary that that overall cycle of mental health throughout is very well maintained.